What's up, Ninja Nerds? In this video, we are going to talk about hepatitis A through E. In this video, we're going to talk about the epidemiology, the etiology. We'll talk a little bit about the virology of hepatitis viruses. We'll talk about how they infect the hepatocytes, how that leads to multiple clinical manifestations, and then we'll get into the nitty-gritty stuff, which is the serology, which is kind of a lot of questions that you see on your constant board exams. All right, so let's go ahead and get started. All right, Ninja Nerds, so before we start getting into all the pathophysiology of hepatitis, we got to talk about the different types of hepatitis, right? So what I want you guys to know is three basic things about these viruses. What is the route of transmission, okay? I want you to know, is it going to cause an acute infection or chronic infection or both? And then the third thing is I want you to know a little bit about the virus structure. So first things first, hepatitis A virus. What do we know about this one? Is it going to cause an acute infection or a chronic infection? It's pretty simple. It's acute infection. A lot of this stuff is just kind of going to be a little bit of memorization. So I want you to remember acute infection. Acute infection is described as though you can rid the virus from the body. Usually this only lasts, less than 6 months in duration. If it's greater than 6 months of duration and you're still infected, it's more of a chronic infection. So HIV is usually cleared pretty well by the human body, okay? Second thing, what is the route of transmission? It's usually transmitted through fecal-oral contamination. Okay, so fecal-oral route. Okay, so it's a fecal-oral route. It helps me to remember anus, so feces comes from the anus. So I know that because of that, that's going to give me a little easy way to remembering that the fecal-oral route is going to be the main way that the HAV virus is going to be transmitted, right? Third thing that we got to know about the virus is a little bit about its structure and its composition. One of the big things that you want to know about this virus, the HAV virus, is that it doesn't have an envelope. So remember, it's no envelope. And what that means is it doesn't have that kind of like lipid bilayer that's surrounding these blue proteins here, which is called your capsid. So you have these blue proteins, and they're made up of capsomeres. That makes up this nice little capsid structure. Inside of that capsid, you have different types of enzymes. All these little pink dots are representative of different types of enzymes. And then inside of there, there's a nice little nucleic acid structure. And what happens to be here is a single-stranded RNA virus. Okay? And if you guys really want to be specific, they call this a positive sense. A positive sense single-stranded RNA. Okay? And all the positive sense means is that this RNA can use the host cell's ribosome to make proteins, translation-wise. Okay? So that covers that one. B, is it acute or chronic or both? Well, it actually causes an acute infection, but then it can actually stay within the liver cell and continue to cause damage to the liver cell for greater than 6 months. So it's both. So I want you guys to remember that HBV is both an acute and chronic infection, okay? So it can cause both an acute and chronic infection. The next thing is, how is it transmitted? 3 ways. I want you to remember 3 ways. 1, sex. 2 is usually through blood, okay? And the third way is perinatal. In other words, you can transmit it to the child, okay? So these are the things that I want you guys to remember. HBV, acute and chronic infection, and it's transmitted through sexual intercourse. It can be spread through blood, right? So needle sticks, different types of transfusions and things like that. Perinatal, it can be passed from the mother to the child. A little bit about the viral structure. We're not going to go into tons of detail because we're going to talk about it in the Pathophys, but I just want you guys to remember that it does have an envelope. It does have this nice lipid bilayer on it, so it does have an envelope. And inside of this, it's going to have these nice capsomeres, which is going to make up your capsid. And then inside of that, you're going to have this nice like DNA structure. It's actually double-stranded DNA. And we're going to be a little bit specific, and we're going to put a P in front of that. And all that means is it's partially double-stranded DNA. I just want you guys to remember that it's a DNA virus, okay? Next thing, HCV. Is it going to be acute or chronic or both? It's actually both. So again, this one can cause an acute infection, but it can actually stay within the liver and continue to cause damage for greater than 6 months. So this one can also cause an acute and chronic infection. How is it transmitted? It's the same as B. It can be transmitted through sex, it can be transmitted through the blood, and it can be transmitted perinatal. So in other words, from mother to child, okay? When you look at its structure, again, it has this purple like envelope. So it does have an envelope. So we'll put here, it does have an envelope. And it has these capsids or these capsomeres. And inside of that, it has this actual nucleic acid structure. And this is going to be single-stranded RNA. And again, to be specific, it's positive sense, single-stranded RNA. The next thing, HDV. HDV is a type of Delta virus, and this virus is very interesting. We have a third point that I want you guys to know about this one. Well, we're going to talk about this. It's mainly a chronic infection. It's mainly a chronic infection, and we'll explain why in just a second. Now, it can cause an acute infection, but I want you to mainly remember chronic infection, and we'll explain why. Second thing, how can it be transmitted? It's the same way as B and C. So it can be transmitted through sex, it can be transmitted through blood, or it can be transmitted perinatal, okay? In other words, from mother to child. Third thing that I want you to remember, especially for HDV or this Delta virus, is that it needs HBV in order to be able to infect the host. So you need HBV. And there's two ways, okay? One is it's called a co-infection. In other words, you take this cell, let's say here I have a cell. I have to have HBV and HDV infect this cell at the same time. That's a co-infection. That's the only way that the HDV will work. The second way is called a super infection. And this is a little bit simpler. All it is you have a cell here. The HBV virus will actually infect this cell, and then throughout a little bit more over time, then as this HBV virus is actually causing damage to the cell, then the HDV virus will actually come. So it comes later. So super infection, HBV causes infection. Later in time, HDV then infects the cell. Or co-infection, both the HBV and the HDV infect the cell at the same time. Okay? Structure, we notice it has an envelope. And we notice that it has a circular stranded structure. It's not double stranded, it's a circular stranded RNA. And we actually call this single stranded RNA, but here's where it's a little bit different. This is a negative sense. Okay, it's a negative sense. Last one here, HEV, okay, hepatitis E virus. Does this cause acute infections, chronic infections, or both? It's mainly acute. There is certain situations in patients who are immunocompromised where it can cause chronic infections, but it's not that common. It's more specifically acute infections. How can it be transmitted? Remember we said fecal oral was for A, right? Well, I remember A is for anus and E is to eat. Okay, so if you want to, I know it's nasty, but anus, you poop out. If someone who's infected with HAV or HEV, they poop into some type of water source, and that water source is contaminated, and then you drink it or you eat from that source, then you can also become infected. So A and E, anus, eat, fecal, oral. Okay, so this is going to be fecal, oral route, okay? Last thing about this virus is, does it have an envelope? There is no envelope, okay? So you want to remember that. There's no envelope on this. It does have these capsomeres and these capsid proteins. And inside, it does have a nucleic acid. And this is single-stranded RNA, positive sense. So what I want you to remember, all of them, all of these viruses, except for HBV, is RNA. Okay? He's the only one that is a DNA virus. A and E, fecal, oral, and acute. B, C, D can cause acute and chronic infections. And they're mainly blood, sex, and perinatal transmission. All right, now that we covered that, let's go into the pathophys. All right, so now let's go ahead and take a look at how these viruses infect the hepatocyte. So we're going to zoom in on a big hepatocyte and look to see how these viruses infect the cell and how when they're inside of the cell, they cause all this havoc. Okay, it's pretty cool actually. So let's take, for example, we start off with our viruses, right? So if you guys remember, we kind of, at the end, I classified these viruses into two different things, right? We said that one of them is going to be single-stranded RNA. That was our, if you guys remember which ones those were, it was the HAV, HEV, HCV, and even HDV is your single-stranded RNA. Okay? We're not going to worry about the positive and negative for right now. Just for right now, remember that it's single-stranded RNA. The other virus that we talked about is going to have DNA, okay? And that's a double-stranded DNA. So this one's going to be double-stranded DNA. And if you really want to be particular, you can put the P in there. Remember that it's partially double-stranded. Not all of the entire thing is double-stranded. And this is specific for HBV. So let's see how, when these viruses get inside, how they use the cell's machinery to make these different proteins and replicate their viruses and cause havoc on this cell. So what happens is these viruses get inside of the cell through an endocytosis mechanism, and then they shed off their outer coating. So they shed off the envelope, they shed off their capsomeres, and they release out here that single-stranded RNA. Now that single-stranded RNA is really cool because guess what it does? It goes down to the host ribosome and uses the host cell's ribosome to synthesize proteins. Okay, so it'll synthesize these different types of proteins. Let's show here, just as an example here, we'll use this orange. Okay, it's going to start synthesizing all these different types of proteins. What are some of these proteins that it's going to synthesize from that? It's going to make proteins such as maybe capsomeres, which are important because they make up the capsid. It might make certain types of antigens that they put on the surface. Okay, and there's other things that we can make like polymerases. Maybe we can make some RNA polymerases. Maybe we can even make some DNA polymerases. And then what we'll do is we'll send these guys to the Golgi or endoplasmic reticulum-like complex, and they'll get synthesized. And we'll make these nice little vesicles that'll contain all these different proteins that we need. Okay, so inside of this, we'll have all these different proteins that we need, and then we'll actually make our virus. We'll see how. Okay, but here's what's cool. If the ribosome synthesizes these enzymes and proteins, what's one of the interesting ones? This RNA polymerase. Why is that important? And it's actually very specific. We should call it the RNA-dependent RNA polymerase. If I get more of these viruses, right, I get another single-stranded RNA in here, and I made proteins, right, from using the host cell's machinery, and I make this RNA-dependent RNA polymerase, guess what can happen? Now I can take that single-stranded RNA and make more RNA, right? So that RNA-dependent RNA polymerase, we'll put here, RNA-dependent RNA polymerase, it can take and make more RNA. So now if I have more RNA, and I have all of these proteins, capsomeres, different antigens, more polymerases, and I combine these two, what am I going to get out of this? I'm going to make my virus. And my virus is going to have that RNA. I'm going to have all the different proteins that I need to make up the capsid, to make up the envelope, all of that stuff. Isn't that crazy how it can do that? And then from there, we can just release these viruses out of the hepatocyte and go cause it to damage other nearby hepatocytes. That's rough stuff right there. In the same way, the HBV virus, it gets inside of the cell, right? So it undergoes this endocytosis mechanism. When it gets inside of the cell, it will uncoat, release off the envelope and release off all those antigens and put into this nucleus. So this is going to be the cell's nucleus. And it sheds off and releases this partial double-stranded DNA. Now there is these little repair enzymes called DNA repair enzymes, and what they do is they come in and they just finish off the double strand. Because if I were to give you an example, just give you an example, how much of this is double stranded? Let's say it's 75%. These DNA repair enzymes will then come in and then completely finish it off to its 100% double stranded DNA. Okay, so it's a simple concept there. Now, what will happen is this double stranded DNA, we're then going to do two things with it. One is I can use the cell's RNA polymerases, okay? So I'm going to use this cell's RNA polymerases. So let's say here I have a RNA polymerase. That double-stranded DNA will then get transcribed. And then from that, I'm going to make RNA. And this is, again, viral RNA. That RNA can then do two things, right? I could have RNA, and this could be specifically mRNA, so viral mRNA. That viral mRNA can then go to the ribosome, where it'll then be what? Translated and make proteins. What kind of proteins, guys? Capsomeres. Different types of surface antigen or envelope antigens. Different types of RNA polymerases or DNA polymerases. Isn't that cool? Another thing that can happen is it can make this specific type of RNA, which is called pregenomic RNA. So pregenomic RNA. And this pregenomic RNA is very, very interesting. Here's the reason why. Hepatitis B virus is actually a type of retrovirus. So it has a specific enzyme inside of it. And we're going to mark this enzyme in a very interesting, let's do pink. There's a specific enzyme that's present inside of this virus, and it's called a retrovirus. Okay, and it's called a reverse transcriptase. So we're going to have an enzyme here called reverse transcriptase. Reverse transcriptase basically takes its reverse of transcription. So we're taking RNA and making DNA. So it takes this RNA and then makes from it DNA. And then this DNA that we're going to get, eventually it will get converted into double-stranded DNA. And if you really want to be specific, it's going to be that partially double-stranded DNA. From here, what can then happen? That partially double-stranded DNA can then come and combine with these capsomeres and with these antigens that are being synthesized and have some RNA polymerases and DNA polymerases and other enzymes that are going to be combined into that actual vesicle and make you a nice little virus. And then that virus can then be released out of this cell. Isn't that insane? That's a pretty cool process. Another thing that's also really interesting is that this double-stranded DNA, it can continue to replicate onto itself because it can use the host cell's DNA polymerase. So that's another thing. It can actually get incorporated into the host genome, and it can continue to keep replicating itself. So you can continue to make more double-stranded DNA, use the host cell's RNA polymerase to make more RNA, make more of these viral proteins, and continue to make more of this pregenomic RNA, and then use that reverse transcriptase from the virus to make more double-stranded DNA and just keep replicating these viruses. It's crazy. And this is one of the things that they relate to maybe this HBV causing hepatocellular cancer. And we'll talk a little bit about that later. Okay, now one more thing I want you guys to understand. Because obviously whenever these viruses start being developed, they cause destruction of the cell. So whenever they actually accumulate within a cell, they do lead to lysis. They do lead to lysis of the hepatocyte. And that lysis is going to lead to cell death. Okay? So that's one thing that's important, and that's how the hepatocyte can get damaged. Another way that the hepatocyte can get damaged. All of these proteins that are being synthesized, okay, sometimes what happens is the actual cells here will actually make these antigens and take them through some type of specific shuttler and send these antigens and put them onto a protein that we express on our cell membrane. All nucleated cells should have this protein. This is called MHC1 protein. It's called the major histocompatibility complex. Now, what happens is, let's say that we take these proteins and we'll mark these proteins as, we'll switch the color a little bit and we'll turn this into this, this maroonish color here. And let's say that these proteins that the virus is making, some of this protein gets exposed and put with this MHC1 complex on its surface. Okay? And we're going to call this one here, this is going to be the viral proteins. Okay? What happens is, when you're having this infection, your body releases different types of interferons, which activate macrophages, which activate T cells. Those T cells are then going to come to this area of where this infection is. Guess what kind of T cells come to this area? The good old cytotoxic T cells. So then these cytotoxic T cells, when they come over to this area here, they're going to have a specific protein that they use to recognize this MHC1 molecule. Okay, they're going to have specifically a molecule here, which is going to hook onto this, and this is going to be called CD8. So CD8 positive, meaning that it has this protein that interacts with the MHC1. It also should have another protein here. Let's do this one in black, and we'll have it cross over a little bit. It's supposed to be able to recognize maybe if there's any types of self-antigens on the cell. Now, what happens is if the CD8 cytotoxic T cell doesn't recognize this abnormal viral protein, it gets set on alert and it starts to secrete specific types of molecules, such as perforins. And these perforins are then going to come into the cell and put holes into the cell membrane. Okay? So they're going to put holes in the cell membrane. Then from there, after we put holes in the cell membrane, let me go ahead and sit down, guys. My knees are killing me. It's going to secrete another molecule here. And this next molecule that it's going to release is going to be called Granzymes. And these Granzymes, what they do is they leak in through these perforins that were made, and they induce apoptosis. And apoptosis is obviously cell death. And so then this cell is going to die. Oh, that's kind of sad, right? So now you understand how these viruses promote such damage, how they replicate themselves, how their replication eventually can lead to lysis of the hepatocyte and cell death, or how our immune system can respond to this, because again, what happens is, if you guys remember, these hepatocytes, whenever they're damaged, they can secrete interferons, and the particular type of one is interferon gamma, that activates macrophages, and then the macrophages will then come and stimulate these different T cells. And this is particularly a T cytotoxic T cell. Okay? And then they'll come here and cause destruction of these cells. So this is how you get inflammation and destruction of the liver cells. All right, so we've set the stage, okay? Liver cells have been damaged. All we did was we kind of took one of these liver cells right here, we zoomed in on it and saw how it was damaged. As these liver cells start getting damaged, what starts happening? Well, let's kind of talk about that. When there's liver damage, your body, your liver, starts producing specific types of cytokines. Some of them are going to be like interleukin-1 whenever there's significant inflammation, interleukin-6, and tumor necrotic factor alpha. What do these guys do? Well, if you guys remember, they get into your circulation, they go to your central nervous system, and they trigger a specific prostaglandin process in the brain. They cause PGE2 and maybe PGF2 production. And what that does is that changes the hypothalamic thermostat and leads to a fever. Okay? And with fever always comes general malaise and discomfort, right? So you're going to get fever and you're also going to get malaise, that general discomfort of the body. So that's one thing that's going to happen. The next thing that's going to happen is whenever there's like damage to the liver, right? So the liver's being damaged, all these cells are starting to die. Toxins can start building up in the blood, right? A lot of these toxins can start building up. And as these toxins start building up in the blood, let's say the toxins that the liver's supposed to be filtering, these hepatotoxins, we'll call them hepatotoxins, okay, they start accumulating because the liver isn't able to perform its function as well. These hepatotoxins will then leak into the actual bloodstream and they'll go up to the central nervous system. When they get to the central nervous system, there's an area in the brainstem, okay? And that area, if we were to kind of like write like a structure here, you have what's called the chemo trigger zone, okay? And the chemo trigger zone is sensitive. So right here, we're going to call this the chemo trigger zone. It's sensitive to these hepatotoxins. And it acts on certain receptors that stimulate the chemo trigger zone. The chemo trigger zone will then activate another structure in the brainstem just nearby. Let's do it here in pink. And when it stimulates this next structure just kind of anterior to it nearby, this structure is called the emetic center. Okay? So you have the chemo trigger zone. The chemo trigger zone will then stimulate the emetic center, Once we stimulate the emetic center, that'll activate nerves that are going to go to the gastrointestinal tract. And guess what it's going to do? It's going to cause this kind of retroperistaltic action. And this retroperistaltic action is going to cause certain types of food and gastrointestinal contents to be pushed in the direction opposite of what it wants to go. You want to go from mouth to anus. This is going to cause reverse peristalsis, where now all of this actual food and contents is going to move upwards and out of the body. So this is going to lead to vomiting, so nausea and vomiting. And that nausea and vomiting, what's important about that? If you're nauseous and you're vomiting and you're throwing up a lot of stuff, this can lead to dehydration, so a decrease in blood volume. You also can spit out a lot of electrolytes. So it can lead to, we'll put electrolyte E for electrolyte, and we'll put plus and minus because there's different types. Electrolyte changes, right? What else could it lead to? If it's happening over a long period of time, it might even lead to weight loss, so a decrease in weight, right? That's crazy. So within the first part of when someone is infected and their liver cells start actually becoming infected, the liver function starts decreasing, all of these molecules can come into the actual circulation, into the central nervous system. And what are their symptoms initially? Fever, nausea, vomiting, electrolyte abnormalities, maybe some weight loss, some general malaise. And you know what else? It's also going to alter the GI motility downstream. So guess what else can happen? Not only will they have nausea and vomiting, they might also have diarrhea. So they're going to present with what's called this prodromal phase. So this first part here is the first stage of when someone is infected. And we call this the prodromal phase. Okay, so this is phase 1. The prodromal phase is fever, general malaise, discomfort, nausea, vomiting, some weight loss, and even some diarrhea. Okay? Then, liver cells continue to get more and more damaged. As they get more and more damaged, guess what else starts happening? Inside of these liver cells, you guys know that inside of these liver cells, there is what's called bilirubin, right? So you guys remember whenever you have hemoglobin, whenever somebody has their red blood cells get broken down, hemoglobin can get broken down into heme, and then that heme gets broken down into bilirubin. But the type of bilirubin it gets broken down into is called unconjugated bilirubin. That unconjugated bilirubin is then taken to the liver, where it's supposed to be reacting with an enzyme, and this enzyme is called UGT, uridine glucuronosyl transferase. It's supposed to stimulate the conversion of unconjugated bilirubin into bilirubin, conjugated bilirubin. But now your liver cells are going to start dying. And so now this ability for the unconjugated bilirubin to get converted into conjugated bilirubin, that's going to decrease. Some of the cells might still be able to do this, but some of the cells might not be able to. And again, what happened? These cells are going to start lysing and dying. And whenever they start lysing and dying, what comes out of these cells? Both of these things, unconjugated bilirubin and conjugated bilirubin. So now let's bring over the unconjugated bilirubin. That's going to increase in the blood. Let's bring over the conjugated bilirubin. That's going to start increasing into the blood as well. And if you want to be specific, here's something you got to really think about. Whenever somebody has inflammation of the liver, this biliary system is in the liver. So sometimes when there's liver damage, there's also this cholestasis-like effect. And what that means is that some of enzymes and some of the molecules that's present inside of this actual biliary system can back up. And one of those is the other point, which is your bile salts. So your bile salts or bile acids. And these can also kind of accumulate in the blood. So you might also get an accumulation of bile salts or bile acids. They're the same thing, really. And what happens with this? Their concentration, the bilirubin concentration in the blood, starts increasing so much that it can start to deposit into certain tissues. One of the areas that it deposits in is into this tissue of the eye, the sclera. It really loves to deposit into the area of the sclera. And what happens is it gives the sclera a different type of color. and it's kind of like a yellowish discoloration. So they get a yellow sclera. And we call a yellow sclera, we call it icterus. So icterus is the yellowish discoloration of the sclera. That's one thing. The next thing is that this conjugated bilirubin and unconjugated bilirubin also start to deposit into the tissues, the thick skin, so palms of the hands, soles of the feet. And when it starts depositing into the skin, it gives a discoloration to the skin. And this is going to be more commonly in the palms of the hand. So two areas, palms and soles. And this is going to cause a yellowish discoloration of the skin in this area. And again, we're going to call this that jaundice type of effect, right? So jaundice-like effect. Another thing, remember your kidneys. Your kidneys are responsible for excreting bilirubin, but they only excrete conjugated bilirubin, okay? Now, if your liver cells are dying, you're getting an increase in the conjugated bilirubin in the blood. That means more conjugated bilirubin is going to the kidneys. That means the kidneys are filtering more of this conjugated bilirubin. If you have a lot of conjugated bilirubin in the urine, guess what that means? It's going to give the urine a darker type of appearance. So now the urine is going to have a dark urine appearance. So that's one thing. So first thing, you get the flu-like symptoms. Secondly, over a period of time, after the liver continues to get damaged, bilirubin levels in the blood, particularly conjugated and unconjugated, start to accumulate, sometimes greater than 2, we say. It deposits in the sclera, causing icterus, deposits in the skin, thick skin, palms of the hands, soles of the feet, causing this jaundice-like appearance, and a lot more of it gets excreted through the kidneys, specifically the conjugated bilirubin, and that causes this dark urine appearance. Last thing that you also have to understand here with this phase is that if the liver activity is decreasing, right? So the liver isn't actually producing a lot of the normal things it happens to produce, which is one of those things is bile. If there is a decrease in the biliary production, right? So less bile, that means within bile, remember what's one of the components of bile? Bilirubin, right? If your liver isn't producing bile, there's a decrease in bile, that means that there's a decrease in the concentration of bilirubin. And again, what happens is, if you guys remember, bilirubin, once inside of the gut, it gets broken down by bacteria into what's called urobilinogen. And then urobilinogen is further broken down by bacteria into what's called stercobilin. Now, why is that important? If you have decreased bile because the liver is failing, that means that you get decreased bilirubin in the actual intestines. Less bacteria break down the bilirubin into urobilinogen. If you have less urobilinogen broken down by bacteria, you have less stercobilin. And that means that you have less stercobilin. Guess what stercobilin is? It gives that brownish pigmentation to the stool. So if you have decrease in stercobilin, guess what that indicates? You're going to have what's called clay-colored. So clay-colored, or they also call it acholic, because you don't have bile salts within it, or you don't have this bile within it. Acholic or clay-colored stools. Basically, they're going to be pale. They're not going to have the pigmentation to it. So to summarize this phase here, in this next phase, you get clay-colored stools. You get yellowish discoloration of the sclera. You get a yellowish discoloration of the skin, or this jaundice-like effect, palms of the hands, soles of the feet. You get dark-colored urine. And one more thing, if the liver is getting damaged, that's inflammation. As a response to inflammation, a lot of immune system cells, a lot of blood flow is going to come to the area, and the liver is going to get inflamed. So one more thing that you also want to remember over here, and we'll just kind of draw another liver, just for the sake of this phase here, is the liver is going to start increasing in size. And so we'll put like we'll make this like it's inflamed, okay? And they call this hepatomegaly. And hepatomegaly produces pain. Where is it? Where's the liver? In the right upper quadrant, okay? So that's called right upper quadrant abdominal pain. So it'll produce right upper quadrant abdominal pain, all right? This phase, where you see the jaundice, right upper quadrant abdominal pain, dark urine, and acholic stools, this phase is called the Ectaric Phase. okay? It's called the Ecteric Phase. Another thing that starts happening here is as your liver continues to get damaged, what is also inside of these cells? Remember those enzymes, those liver enzymes? So as your cells continuously get beat up and they start popping and releasing out all these different contents like the bilirubin, guess what else starts leaking out? Other enzymes. You know what other enzymes start accumulating inside of the blood? AST. Again, that's an indicator of liver damage. What else starts accumulating? ALT starts accumulating. Also remember, right next to these hepatocytes within the liver is actually going to be your biliary circulation. And so whenever the liver's damaged, the biliary circulation will also subsequently be damaged. So guess what else is going to increase a little bit? There's enzymes in this. Alk phosphatase, okay, alkaline phosphatase. GGT, that is also going to increase a little bit. What else? You know, your liver makes clotting proteins. So it makes so many different types of clotting proteins, right? So what happens if you decrease the number of clotting proteins? Well, it depends, right? Clotting proteins, there's two pathways. There's an intrinsic pathway that we use them for, and there's an extrinsic pathway. Remember, if you decrease clotting proteins, you decrease the proteins in the intrinsic pathway, and you decrease the proteins in the extrinsic pathway. What specific test monitors the activity of the intrinsic pathway? It's the PTT. And what happens is, if you have less proteins to cause a clot, the time it takes for it to bleed, the time it takes for the clot to form is going to increase. So your PTT is going to increase. Extrinsic, if you have less proteins for that, it's going to take so long because you don't have enough proteins to cause a clot. So the time it takes for it to clot is going to increase. This is your PT or your INR. Oh man. So what does that mean? You get an increase in your PT-INR with this ecteric phase. You get an increase in the PTT. You get an increase in all of these liver enzymes. You get an increase in this bilirubin. Oh my gosh, there's so many things that happen in the ecteric phase. Another thing to finish off how this can happen here. Sometimes in certain situations, particularly hepatitis B virus and hepatitis C virus, they can also cause infections of other tissues besides these ones. So what happens is the viruses can cause, imagine here, you have the virus, right? And your body is going to try to produce immune system like reaction to it, right? So your plasma cells, if you guys remember your plasma cells, they're going to produce antibodies against this virus. What happens is these antibodies and the virus combine together and they make an immune complex. And these immune complexes get deposited into various different tissues, which causes an immunological reaction and a lot of inflammation. So what are some of the tissues that it can get deposited into? It can get deposited into the synovial joints and cause arthritis, different types of inflammatory arthritis. It can get deposited into the blood vessels, walls, and cause a specific type of vasculitis. One of the more common ones, especially with HBV, is polyarteritis nodosa. And again, you see this more with HBV. The immune complexes can also deposit into the pericardium or into the myocardium of the heart. And what can this cause? This can cause myocarditis and pericarditis. They can also deposit into the glomerular basement membrane of the kidney and cause glomerulonephritis. So there is two types. It's called membranous glomerulonephropathy and membranoproliferative glomerulonephropathy. So those are the two types it can cause. But again, one of the things that you want to remember with all of these is you see this more common with Hep B and Hep C. Another thing is that, guess what? These little complexes can also bind to platelets. They can bind with red blood cells, and they can also affect your granulocytes, okay, your neutrophils. And so it can decrease your platelets. What is that going to call? What's that called? That's called thrombocytopenia. It can cause destruction of your red blood cells. That's called hemolytic anemia. It can decrease the number of neutrophils. That's called neutropenia. But it can do one more thing. Whenever you have a viral infection, what did we say it increases? It does, just don't forget this one, it does in situations where you have a viral infection, it increases your lymphocytes. So whenever you have a viral infection, if you did a CBC with a diff, you would find that they have an increase in lymphocytes, and if you did a blood smear, you'd look at the lymphocytes would be huge. They call them atypical lymphocytes. But you'll see a drop in neutrophils, you might see a hemolytic anemia, and you might see a drop in platelets. But these are some of the extrahepatic manifestations. So to kind of summarize these different phases, remember, first phase that you have whenever the liver cells are infected is the prodromal phase. That's when you start showing the signs of like the flu-like symptoms, right? Second thing that happens, you go through the ecteric phase. So what happens within the ecteric phase is you get the hepatomegaly, right upper quadrant pain, dark urine, there's jaundice, and then these acolic stools, right? The third phase, if you guys really want to remember this one, is called, the third phase is whenever your body starts to resolve the infection. So it's called the convalescent period. Okay, so the convalescent phase. And this is very simple. It's just you're starting to resolve. So what does that mean? That means that the flu-like symptoms pretty much are going away. The jaundice starts resolving. You might not have as much scleral jaundice or icterus. You might not have as much jaundice of the skin. The urine might stop becoming so dark. The hepatomegaly might start going away. The stools might become normal color. Your liver enzymes might start going down. Your PTT, PTINR, they might start going down as well. Your body's resolving from that infection. But don't forget, patients with hepatitis B virus and hepatitis C virus, they can cause chronic infections for a long time, and they can produce damage to other tissues through these immune complexes. And again, we call this the extrahepatic manifestations. Okay? And again, you see this mainly with who? You see this mainly with hepatitis B virus. So again, you see this with hepatitis B virus and hepatitis C virus. So these are called your extrahepatic manifestations. So I want you to remember that specifically. There is one other thing, but it's just a simple thing. Hepatitis C virus and hepatitis B virus, it's really weird. In really cold temperatures, these immune complexes can attack your clotting proteins and enhance clotting. And they call it cryoglobulinemia. It is another type of extrahepatic manifestation, but I think that this is good enough to put this point home. Last thing I want you guys to understand, in certain situations, again, going with the HBV and HCV, remember, they can cause chronic hepatitis. So what does that mean? Remember we said that these viruses are infecting the cells, right? So it kind of goes like this. You have your cells here, right? So here's going to be a hepatocyte, right? And then these viruses, the HBV virus and the HCV virus, they infect these cells. And as a result of that infection, these cells undergo cell death, right? Now, with that, there's a couple options. We can take this cell death and we can try to undergo, after the cell death is occurring, we can have a fibrosis process where there's going to be fibrous tissue formation, right? Or we can try to regenerate some of these cells, okay? So we can try to do what's called mitosis, right? And we're going to try to regenerate these cells. Over time, though, if you have increased HBV infections and HCV infections, you're going to increase the cell death, right? That increases the level of fibrosis, and that increases the number of mitosis that this actual cell is going to be undergoing. What's the problem with that? With increasing fibrosis, increases the risk of cirrhosis. And with increasing mitosis, what's the issue whenever you have a lot of replication? A lot of replication means what? There's a chance for a mistake within the actual replication process. And therefore, there's an increased risk of cellular dysplasia. And with that cellular dysplasia comes the increased risk of what's called hepatocellular carcinoma, cancer. So this is the things that you got to worry about when we talk about the chronic infections. So this is the scary thing with the chronic infections, but specifically your hepatitis B virus, C virus. And if you guys really want to remember, even the hepatitis D virus. But again, if someone has hepatitis D virus, that means that they have a hepatitis B virus. All right, engineers, so in this video, we covered the types of hepatitis viruses, A all the way to E. We went into deep pathophysiology and even the viral life cycles. We talked about how these viruses can produce multiple different types of clinical manifestations, as well as the labs that you can also pick up within this process as well. I hope all of this made sense. I hope you guys did enjoy it. And if you guys did, please hit that like button, comment down in the comment section, and please subscribe. Thank you guys for just being such awesome ninja nerds. And if you guys want to communicate with us, you guys can go down in the description box. We have links to our Facebook and our Instagram account. Leave messages. We would truly appreciate it. We'll try to get back to you. Also, we do have a link to our Patreon account. If you guys are willing to even donate $1, we would truly appreciate that. It helps us to continue to make videos for you guys. But as always, Ninja Nerds, we love you, we thank you, and until next time.